Hey everyone, Professor Davis here, and we are going to look at the neurological exam. Now, this is just reinforcing a lot of stuff we looked at back in chapter 13, where we looked at the spinal cord and the brain. But we want to look at the neurological exam specifically because it does test our central nervous system and our peripheral nervous system. Now, the purpose of the exam is the assessment of both sensory neurons as well as motor neurons. This helps us determine whether the nervous system is functioning like it should. And if it's not, where is the problem located? That's kind of the focus here of the exam. This is an exam that can be done very rapidly. It should only take about 5 minutes to perform the whole entirety of the exam. However, if there is something detected that is wrong, we would then do further tests to find out more about it. It does consist of a physical exam, which is what we're going to focus on here in this particular chapter. However, you do also need to take into account the patient's history. All right, so you've got to look at their history as well. It is used to screen for certain kinds of diseases or issues, things like trauma. If we talk about like traumatic brain injuries, brain bleeds, things like that. We also would see that it could be partly used to look at strokes, whether a patient's having a stroke, neurodegenerative diseases like Parkinson's, Alzheimer's, Huntington's, MS, things like that, as well as developmental disorders could also be used here. Now, we're going to look at the breakdown of a neurological exam, and then I'm going to talk specifically about each of the parts. So when we look at a neurological exam, it does have 6 subsets to it. We are going to test their mental status. The mental status is going to be looking at the bigger part of the brain, which we would call the cerebrum, the highest part. This is going to look at like memory and judgment and different things like that. We also see we can look at the cranial nerves. We learned about them. There are 12 pairs of cranial nerves. We'll test each of them through the cranial nerve test. So we're looking at the nerves and the brainstem of how they integrate into the brain. We then are going to look at sensory and motor aspects, and these are going to look at how the spinal cord is functioning here, as well as the peripheral nerves, because this is going to be where we're getting information from outside of the central nervous system, bringing it to the spinal cord. Is it conducting it the way that it should? And then is the response, the motor response, what we would expect? We also then are going to look at the coordination. Now, coordination and gait kind of go together because they both test the cerebellum, but you could test coordination without actually testing their gait. In reality, though, you need to look at both. So let's dive in and look at each of these in a little more detail. So the first one is the mental status. Now, guys, with the mental status, we're looking at memory, orientation, language skills. We're evaluating a lot of things here. And when we're checking the mental status, we want to look at the level of alertness and awareness of the patient, as well as how well do they interact with us. And so there's a lot of questioning that comes into play here, where we would ask questions like, do you know where you are? Do you know the date? Do you know who the president of the United States is right now? Could you tell me something that's in the news recently? These are things to look for: alertness, awareness, can they interact with you? And also looking at what we call orientation. Where are they at right now? We also may ask them to follow certain commands. This is where we would tell them to do something without showing them. This allows us to see if they can problem solve through us giving them multiple steps to something and then performing that task. This allows us to also look a little bit at coordination as well. And we a lot of times want to look at the patient's history to see if there's already a baseline so that we can compare our new findings to that baseline if at all possible. So how do we check mental status? There's a number of things we can do. For orientation and memory, we can look at awareness of time. Do they understand like where they are, when they are, that sort of thing. We can also ask them to repeat certain things back to us. We may say, hey, can you remember 3 words for me? And later I'm going to ask you about them. So it might be like apple, shovel, and rain. And so you say, okay, in a little bit I'm going to ask you what those words were. And so later on in the assessment, you might say, hey, do you remember those 3 words I told you to remember? And if they can tell you apple, shovel, rain, then we're good. But they may not be able to. With this too, we will look at if they have other memory things. Can they remember things from the past? So testing memory is going to be important because this helps us look at if the patient has what we call a type of amnesia. Now, amnesia comes in 2 forms. We can have retrograde amnesia, where you can't remember the past. You can't remember things like that happened a long time ago. However, you can form new memories. Or you can have anterograde amnesia, where you cannot make new memories. You can remember stuff in the past, but new memories can't form. And that's like if you were to see the movie 50 First Dates, the character that Drew Barrymore plays, she has anterograde amnesia. When we also look at memory, there's different types of memory we can test. We can look at episodic memory. Do they understand like what happened first, second, and third in a series of events based on a memory? Procedural memory, meaning can they perform an actual task like tying their shoe or riding a bike? Now, not to say you're going to test that when you go to the doctor, but you might ask them to complete a procedure, like asking them to look at steps and complete them. We also do short-term memory where we would, again, ask them like to remember some questions or some numbers and then be able to give them back to you. Now, all of these are also going to be testing speech and language through the process. Can they understand what you're asking of them and what you're talking about? When they communicate back to you, do they have fluency and are they coherent in their responses? Can they represent or pick out patterns of poetry or rhythm, rhyme? Like, can you ask them, like, can you tell me a word that rhymes with? And you give one word and they give you another. These are ways for them to go through this process. You can also look at their volume of how they're talking to you. Is it normal? Is it very high? Is it very low? Rate of speech. Is it super fast or is it really slow? If their speech is really slowed and slurred, we call that dysarthria, and that's an issue where that communication's not happening properly. If they're not able to communicate back to you, this is known as aphasia. There's a couple of types of aphasia. We have expressive aphasia. Expressive aphasia is where they cannot express themselves. They cannot get their mouth to work properly to get the words out. So their tongue gets in the way. They can't produce the sound. They may just sound like noises. They aren't actually making words. On the other hand, receptive aphasia is where they're not hearing it correctly. Like you're talking to them, but in their brain, it's not processing what they're hearing. The reception is out. And so these are two different areas of the brain. Expressive is more of what we call the Broca's area, whereas the receptive is more the Wernicke's. Now, these two areas are supposed to communicate in order for you to have good language skills. And if they're not communicating, that's a type of conduction aphasia that's not very common, but it is a type of aphasia. Now, these things, guys, when we're talking about amnesia, memory issues, aphasia, those have to take further tests to actually find out what's going on. But the neurological assessment can let us know if something is actually wrong, okay, in the process. The next test we want to look at are the cranial nerves. We learned about these. There's 12 pairs of cranial nerves and we need to test them. Now, some of them are sensory, some are motor, and some are both. So sometimes the tests have multiple parts to them here. Now, with the cranial nerves, we do want to make sure that we're looking at movements that they may help with. We look at their special senses and general senses as it relates to the head and neck. And cranial nerve 10, if you'll remember, does wander out and into the chest and abdominal areas. And so it sometimes is a little harder to test, but we do have a few tests for cranial nerve 10. So when we're looking at these tests, there's certain specific things that we can look at to see if they're working. And so here's one of them. Now, we looked at these in lab. All right, so if you remember in lab, you looked at this kind of stuff. So we see here for olfactory is going to be smell. So you have them smell something like coffee, mint, smelling salt, something. If they cannot smell, it's called anosmia. This is going to be where there's an issue that's happened. Boxers or MMA fighters who get hit in the face a lot, especially in the nose, they may deal with this. This was also one of the symptoms for the original COVID. Okay, and so this is part of that where they can't smell. Number 2 is optic, and so this is vision. So we would use the Snellen chart where they will look and tell you, say, okay, I'll need you to read line number 3. What letters do you see? That's going to help us know if they actually can see or not. Your eyes also have 3 cranial nerves that help with movement, and these are cranial nerves 3, 4, and 6. So we have the oculomotor, trochlear, and abducens. And so you being able, where they say, hey, can you look up, down, side to side, towards your nose, like crossing your eyes, those are all going to be testing those particular cranial nerves. They also could be testing if you can follow instructions as well there. The trigeminal nerve, cranial nerve 5, is trigeminal because it has the 3 branches. This is going to be where we look for sensory information from those areas. We also see that we can look at movement of the mouth because that's part of that 3rd branch. So we could test using a Q-tip. Can they feel touch? Can they feel pain? Can they feel that kind of stuff? Cranial nerve 7 is facial nerve, so that kind of is being tested as well with the trigeminal, but this also could be testing for taste, have them taste something. Cranial nerve 8 is vestibular cochlear, and this is twofold. So the Rhine test is for hearing. So we would ask them if they can hear certain things, like maybe using a tuning fork or things like that. When you were a kid, you may have taken a test where it said, which ear do you hear it in? And you'd have to raise that hand, whichever ear you're hearing it. We also have the Romberg test, which is the vestibular branch for balance. The Romberg test is also important for sensory function because your body should be getting sensory information from all of your muscles, knowing where they're at and what they're doing to help you keep your balance. So the Romberg test not only tests cranial nerve 8, it also tests some of the sensory that we're going to look in the sensory exam. Cranial nerve 9 is the glossopharyngeal. It's also for taste, like cranial nerve 7, but the main way we test this one is the gag reflex. So if we hit the gag reflex and the patient gags, cranial nerve 9 is working. Cranial nerve 10 is the vagus nerve. It does help you with repeating consonant sounds, like producing noises and sounds in a particular way. And so you may have the patient say, okay, I need you to repeat after me, la, ka, pa, la, ka, pa, and they would repeat it. And if they can repeat it, this nerve is normally working. So cranial nerve 11, the accessory nerve, is going to be more in the spinal area. And this is going to be helping to know if you can raise your shoulders, like shrugging your shoulders, but also turning your head is part of that. Cranial nerve 12 is the hypoglossal, and the main way we test this is we have the patient stick out their tongue. If they can stick out their tongue, we're good there with cranial nerve 12. Now again, you're going to see some overlap happening as we go through some of these tests, which leads us then to the sensory exam. Sensory exam, we could potentially have sensations from our somatic area, which are skin, muscles, and tendons. Those are going to be what you're consciously aware of, and you can communicate what you're feeling or kind of experiencing at that particular point. Whereas the visceral senses are more deeper. They're your organs, like your heart, your stomach, that sort of thing. We can't really test that with this neurological type of exam. So these sensory exams are going to focus more on the somatic side. So light touch, pinprick, temperature, vibration, sensing how your body is moving at a certain point. That's what we're checking here. So we can do a number of things. They could use a cotton tipped applicator. They'll have you close your eyes and they will like brush it across certain surfaces. This will tell you whether or not you feel it or not in certain areas. They can also take that same cotton tipped applicator, break it, and use the sharper edge of the stick to be able to tell if you can feel something that's different. They can use tuning forks. Not only can we use those for testing cranial nerve 8, but we can also use them to test for vibration. Can you feel the vibration in different areas of your body? We also talked about the Romberg test last slide, and that's where balance. The patient would stand, they will get their balance and then close their eyes. And when they close their eyes, do they waver a little bit? If they do, that's okay. But if they fall over, that's not working properly. All right. And so they're testing their balance. Now, on the motor side, this is going to look at the skeletal muscular system and how it's communicating back with the sensations that come in. And so this is going to look at a number of things. We want to look at tone of the muscles. This is going to be done through passive range of motion, resting tension. So the patient, the doctor might say, okay, relax your arm. And now I'm going to just move it. They're testing to see if the muscles can be utilized. They'll move your wrists back and forth. They might move your feet, your leg, but they're passively moving it. They are not having you engage your muscles. On the other hand, they will also test for the bulk of the muscles. Sometimes if the muscles are bulkier, it's not necessarily that they're stronger. There could be something going on. So they're going to be testing and looking at that. They also want to look at strength. And this is where they say, okay, now you let me move your arm. Now I want you not to let me move it. I want you to push against me. And so they'll push on your arm and you're pulling back. Okay. And it's going through that process of checking the strength. And we want to do both sides because your right side and your left side should be comparable. Okay. We also see another test they do is called the pronator drift. This is where they have the patient, they can sit or stand, but they're going to close their eyes with their palms up, arms extended like this. And they're going to check to see if they start to drift and pronate their hands. If they go back into a pronated position, then something's going on with their supination maintenance. And so we wanted to kind of test that out as well. Another thing that integrates both motor and sensory exams is testing your reflexes. We looked at this also in lab. So this is a sensory input with a motor response, testing out the spinal cord and those particular spinal nerves. Deep tendon reflexes are done most often. That's what we normally think of when we think of reflexes, where they have the little hammer and they hit your knee and you kick out your leg, or you do the biceps, triceps, that kind of thing. Superficial reflexes are where we're going to come across the skin expecting a type of reflex. The best example of this is called the plantar reflex. This is going to be where they drag something across the bottom of your foot. As an adult, your toes should come in. If they don't, they spread out. That's called a Babinski sign, and that's telling us something is wrong. All right. If reflexes are lost, this could be an indication of paralysis or a weakness that has happened due to the connections within the spinal cord. And so we want to test these out in the neurological exam as well. Now, this brings us to the last group, which is coordination and gait. So with coordination, it's going to test proper cerebellar function. And coordination, a lot of times with these subtests where they're looking at the appendicular musculature, which are your arms and legs, like your limbs. Also your axial musculature, like your trunk, can we utilize them and how we utilize them together. This is also seen a lot of times in field sobriety tests. Okay, when people get pulled over for they're suspected of being drunk, they want to test this stuff out. They're testing this. They're doing part of a neurological exam in that test. So a lot of times in a neurological exam, they'll do a tremor check. So you'll have to put your hand out and we want to check to see if there's tremors that are present. We can also do a check for reflexes, which we talked about just a second ago. We can have them do like what we call a finger nose test, where you make them put their hands out and they have to go back and forth, finger to their nose. Okay. We may even have them do certain things like with their hands, fast movements, okay, repetitive movements to see if their coordination, because if they continue to go one way or another way and they don't follow the instructions, there could be a coordination issue. We can also have them practice what we looked at for cranial nerve 10 with that la ka pa, where they repeat something that has like a rhythm to it. That could be used as well for coordination. We also see with gait. Gait is where you're taking that coordination and you're also looking at it with complex types of movements. This can be where they're looking for ataxia. Can you not coordinate your movements properly when it comes to walking? Because guys, when we look at a normal gait, your normal gait requires a lot of things. Okay, it's very complex. It requires vision. It requires strength, balance, your coordination, knowing where your joints are at any given position. That is looking at gait. And so we want to observe it in multiple ways. First way, we want them to stand up and we want to see if they're stable, if their base is stable. If they have ataxia, a lot of times their base is really wide and it's unstable and they are not safe to continue on a lot of times with the gait test. We may have them balance on one foot to check out that balance again. Then we're going to ask them to walk across the room. Okay, they'll walk down and back, and through that process, we can check to see if they have normal gait patterns. You may even have them change their gait and say, okay, I want you to now walk across the room heel to toe. Okay, heel to toe, heel to toe. All right, now I want you to jog across the room. We're going to check all these things out. But guys, we can look to see, are their arms swinging properly? Are they actually using their foot properly where they do go heel to toe when they're walking? Do they spend more time on one foot versus the other? Do they walk on their toes? These are all things that we could potentially check when we're looking at their gait. A lot of times with ataxia as well, something will happen where they can get their gait going, but then they may have an issue where it's like the stutter step, especially like visually, if there's like tile that changes on the floor or it goes from tile to carpet, it might cause some issues. That could tell us that something is not communicating properly within the nervous system. Now, again, I told you that a lot of this stuff is used to help us to diagnose or to look at certain neurological deficits. These could be things like cerebrovascular accidents, known as CVAs, like strokes. There's different types of strokes. And the point, though, is that the brain is not getting enough oxygen and blood to those areas, and we would see weakness and issues. All right, so the right side might be stronger than the left side. They may not even have feeling on their left side. Those are things we could see with stroke, as well as potential issues like with speech and all. Neurodegenerative diseases. Some of these point out certain neurodegenerative diseases easier, like memory issues. Alzheimer's might be an issue. If they have lots of tremors, that could be something with Parkinson's. And so these are some of those tests that we'd utilize, as well as for infection, trauma, and some congenital disorders, as well as developmental disorders, which we did talk more about in the last chapter. All right, so if you have any questions or concerns as you're going through these, you can look into your textbook, but you can also reach out to me with any questions. So Again, any questions, let me know.